Today, we are featuring the National Health and Aging Trends Study, or how we refer to it as NHATS. Next slide. The agenda for today's call is similar to previous webinars. We'll start with some brief introductions and then go over the webinar logistics, followed by a brief overview of the NIA Data Linkage Program, which then leads into our featured topic, the NHATS project. At the conclusion of the presentation, the panel will hold a Q&A session. By way of introduction, I'm Susan Seifer, the director of the NIA Data Linkage Program. Today, I'm joined by Dr. Jennifer Schrack and Maureen Skehan from Johns Hopkins University. As far as logistics go, given the webinar format, our team is requesting that all questions be submitted via the Q&A chat box, which can be found in the lower navigation pane. The panel will do their best to answer all of the submitted questions at the conclusion of the presentation, time permitting. If there are any remaining questions that we didn't have a chance to answer, we will be happy to follow up with you via email following today's session. Now, for a brief overview of the NIA Data Linkage Program. Next slide. NIA established the linkage program to address 3 challenges that researchers face relative to gaining access to CMS data for linkage to their studies. The first challenge is the time and cost for researchers to access CMS data. To overcome this, NIA collaborated with CMS to structure this program in a way that would allow researchers to provide quicker access to CMS data without incurring any data fees. One condition, however, is that researchers must use the CMS linked data in a federally authorized system that complies with all the federal data security requirements. Finally, NIA recognizes that not all researchers are experts in the use of claims data. The linkage program offers knowledgeable CMS data support staff to assist researchers in dissecting the CMS data and understanding it further. Next slide. Building on these challenges, the primary goal of this program is to facilitate high-impact research in the area of health and aging while minimizing the cost of the data. Next slide. Our CMS comprehensive data inventory includes the Medicare enrollment data, parts A, B, C, and D, as well as the CMS assessment data, also known as MDS, OASIS, or IRF-PI. We also provide access to Medicaid data. Next slide. The CMS and study data is delivered to researchers in the linkage enclave. This is a set of secure workspaces where researchers are able to analyze the CMS linked data. Each researcher gets a dedicated project environment, which is accessible to only the authorized members of the research team. The linkage enclave offers a variety of statistical packages, software packages such as MATLAB, Python, R, SAS, SPSS, and Stata. The enclave also features a proprietary tool called the job board, which is a load-balanced, high-speed server farm which can be utilized to run your statistical packages, often in substantially less time than running the program using local resources. Next slide. The enclave also features a file transfer tool that allows the transfer of files into and out of the enclave. Importing files is generally restricted to code and supplementary files that have been approved by your study team. Exportation of requirements are aimed at supporting dissemination of your research findings and are a bit more strict than the data imports. All data exports should be aggregate level data with no PII, PHI, or small cells. Data transfers out of the enclave require review by both the NIA Data Linkage Program as well as the study providing their data. Next slide. The NIA Data Linkage Program offers a 3-pronged support structure. The linkage contractor offers access to and support using CMS data, as well as the enclave and enclave associated support. NIA supports the researchers not only through its support of the linkage program, but also through the NIA DUA review process, which is the process that is used to gain access to CMS data. The study team offers their unparalleled knowledge of their data and provides associated support to the researchers in the use of the data. The linkage team can be accessed through email or via phone Monday through Friday from 8 a.m. to 8 p.m. Eastern Time. Now, I know this was a very, very quick overview of the NIA data linkage program, and our team is happy to follow up with any questions following the presentation or via email at a later date. But now, without further ado, I would like to introduce Jennifer Schrack from Johns Hopkins University, who will lead off today's discussion on the National Health and Aging Trend Study.
Hey, thank you, Susan. Okay, next slide. So, as was already mentioned, this is just a little bit of overview of what you can expect from us today. Get the next slide. And I want to give you a little bit of an introduction to NHATS for those of you who may not be familiar with what we offer. So NHATS is a platform for scientific inquiry that's designed to guide efforts to reduce disability, maximize functioning, and enhance quality of life for older Americans. Our study design supports the study of disability trends and dynamics in older people. It was developed with a broad multidisciplinary input from scientific communities through multiple mechanisms. So it doesn't just concentrate on epidemiology or health services research, it concentrates on reaching many different disciplines. So it has a very, very wide net. And dissemination of our data is a key component. Next slide, please. So NHATS has been around since 2008. That's when the grant was actually awarded under a cooperative agreement with NIA. And we're now entering our fourth grant cycle. We just started it in July. Our study population is Medicare beneficiaries age 65 and older. So that's who we sample from. And that's, you'll notice in our data, everybody is 65 and older. So that is our sampling frame. Like I mentioned, it's the CMS Medicare enrollment file, which gives us the ability to 100% match to Medicare claims because everybody comes from that database. Next slide. Our design is annual in-person studies in terms of we deploy a lot of interviewers through Westat to our participants out in the field. They go to their homes and they interview them annually in person. Periodically, we replenish the cohort as people start to either drop out or pass away. We oversample older Black and Hispanic individuals to try to reach the segment of the population that is really historically underrepresented. And our content is guided by a conceptual framework that is centered in late life disablement and its components. So we're thinking about people's capacity for activity and to engage in the things that matter to them. We think about the environment in which they live, and then we think about the availability and successful accommodation of compensatory strategies. And then we release data annually, usually in the fall. We strive to have well-documented data files and documentation. So we have user guides, we have different education associated with each data release that is designed to help our users. Next slide, please. So this is our conceptual framework that I mentioned. So you can see new in this latest grant cycle, we have both the older adults perspective, so that's the NHAT side, and then we have the caregivers perspective. So we have a sister study called NSOC, which is the National Study of Caregiving. And so we try to get both the older adults perspective and their caregivers perspective. And then from that, we derive information about the environment. Currently, how they are living and where they're living and where they've resided over the life course is a new component that we're striving to add to NHATS in this current cycle, but also the kind of things that they've been exposed to and the conditions that they have. So if you look on the left side of the screen, the blue side, we're thinking more about the older adult conditions. So health conditions such as impairments in body functions and structures, their capacity for physical, cognitive, and sensory functions. So we have physical testing, we have cognitive testing, we have lots of questions about their ability and accommodations to do things. And then we actually have sensory testing as well for hearing and vision, and we're working on adding olfaction in the coming rounds. And then we look again, like whether they're receiving accommodation. Can they do these things independently? Can they do them with help? If so, are they getting the help they need? And then again, that goes back into how they are able to participate in the activities that matter to them. And also, we are very interested in understanding their physical activity and sleep patterns. So we started looking at that in the last grant cycle. In this grant cycle, we're going to continue to do that, and we will expand that in the coming rounds. And then on the purple side, which is less accentuated, we have the caregiver's perspective, which is looking at the care provided, caregiver's background and resources, whether they're getting what they need in terms of the care network, and then caregiver outcomes, both positive and negative. Next slide, please. So this is who we are by the numbers. So the blue bars you can see is the original cohort. So NHATS was funded in 2008, and we started collecting data in 2011. And so that is the blue bars, the blue cohort. So you can see we have quite a few people that we've been following for over a decade. Excuse me. Then the green bars are those that were added in 2015. And then the purple are those that we've added in 2022. And we are also still adding on in the 2023 cohort, which you'll see that data will be released soon. So that's what the pinkish color is, who was added in the most recent round. So we now have really 3 cohorts, because we think of the 22 and 23 cohorts as one that were added together. The lighter colors are denoting those who were deceased between rounds. So we do try to get information on those who pass away. Next slide, please. So what do we do when we deploy the interviewers to the field? They do what's called a sample person interview, or we refer to it as the SP interview. It's completed with the participant, so about 93 to 94% of participants complete their own interview, or with a proxy respondent for those who are not up to doing it themselves. So it's about 6 to 7% of participants. Again, they do physical performance and cognitive testing, hearing, vision, and in a subset we have a subset of accelerometry. I should also mention CogState in round 11 through 13 was a special cognitive test that we did. And so that is designed to look at people's cognitive performance on a tablet. We also have a facility questionnaire, which is completed with a staff person. So if we find out someone lives in a facility, then we try to get more information about the facility from that staff person. And this gets information on the levels of care provided, the services that are available, and also the costs of the care that's provided. And then for those who pass away, we do our best to get some information from their next of kin. It was introduced in round 2, so that would be 2012. It's conducted with a proxy respondent, and we do get fairly good responses on this. Next slide. These are our core assessments. So you can see there's a lot of them here. I'm not gonna go through all of these. You can read these and you can find these on our website. But really it's designed to get at where the person's living and how they're doing within their own environment in terms of mobility, in terms of capacity, technology, their self-care. All of these things are on here. We look again at physical measures like their physical performance, their height and weight. And then we also get information about their insurance, their well-being, their participation in the labor force, their economic well-being, and so on. So there's a lot of information there. There's got to be pretty much something for everyone who's interested. Next slide, please. Okay, I think I'm handing this over to Maureen now.
Yes, thanks, Jen. I'm going to go over what NHATS files are available. So NHATS organizes its files into 3 classifications, which include the public use files, the sensitive files, and restricted files. I'm focusing just on files that are also available in the linkage enclave, where you will access the linked CMS data. So the vast amount of our data are included on the public use file. Right now, we have rounds 1 through 12, so that's 2011 through 2022 annual data files. And within the public use files, there's the sample person file, the SP file that Jen mentioned. This is where most of the interview data are located, along with the physical performance activities and that facility questionnaire. The other person file, or OP, consists of individuals that are named or identified in the sample person interview. So this includes spouses or partners, household members, children, social network members, helpers, so folks that help the NHATS older adult with daily activities, proxies, and contacts. The tracker file includes information on the sample that was drawn for NHATS, includes the year the person entered the NHATS study, the case and interview status at each round, along with the interview month and year. Starting in round 11, we added this tablet activities file. This file includes the data that were collected, the objective vision and hearing data that were collected, along with the CogState cognitive activities. And finally, there are the accelerometry files that also started in 2011 that we collected for a subset of NHATS participants. The next classification of data are the sensitive files. We have those for sensitive demographic files for the sample person and the other person files. This includes continuous single year age of the sample person and selected OPs. And on the SP file, there's some additional information as well. The National Study of Caregiving, NSAC, is also sensitive. And in round 7, we collected dried blood spots. And from that data, we were able to conduct 4 assays, which are available in the dried blood spot assays file. Those include high sensitivity C-reactive protein, HbA1c, CMV, and interleukin-6. And we recently released a set of polygenic scores that are provided for a variety of phenotypes based on some GWAS. And the restricted tracker file is available in the linkage enclave if you qualify for it. This includes the same information that's on the public use tracker file, with the addition of the actual day of the interview, which can be important for research using the NHATS CMS data. The public use and sensitive files are available on the NHATS website. For the public use files, you just have to register and then you're able to download the files. And for sensitive data, you have to complete a very brief application and then you're granted permission and you'll be able to download the files. Next slide, please. I'm going to briefly highlight what CMS files we have linked to NHATS, thank you, and that are available. We have the master beneficiary summary files, parts A and B claims files, part C encounter data, part D prescription drug event files, medication therapy management files, Medicaid data, MedPAR files, and the IRCLI, MDS, and OASIS assessment files. The years that are available are listed on the screen. Most are available through 2022 or 2021, depending on the availability that is out right now. One thing we wanted to make clear to folks is that the claims are available for the cohorts that were added in 2011 and 2015. The 2022/2023 cohorts are not linked to the CMS files yet, but they will be. So that is forthcoming. Next slide. All right, so you know what NHATS data is there, what CMS data is there. How do you apply for these data? So DUAs are required with NHATS via Johns Hopkins University and NIA. To qualify to apply for the data, the investigator must have a PhD or other terminal degree and a full-time faculty appointment at a US-based university or research institution. And to start the process, you're going to apply to NHATS first. Next slide, please. Here we have just a list of the application materials, which include checklists, which shows you everything that you need to complete or fill out, an investigator form, a project form that you'll list the project title and an abstract, a 2 to 3 page research plan describing what you will be doing with the NHATS CMS linked files, a copy of your full or expedited IRB approval. These data do not qualify for exempt status. We have in our application materials on the NHATS website, there's a memo that we wrote that you can provide to your IRB, because oftentimes they will deem this not human subjects research, but we do require a full or expedited review. There's also the NHATS CMS linked data request form where you'll indicate which files and which years of CMS data you would like. And then some additional forms that you may or may not need depending on what research you're doing and who you're working with, including an HRR, restricted tracker file request form, an external file linkage request form, and supplemental data use agreements with research staff. So that's if you have any staff members working on your project who need access to the enclave as well. Next slide, please. And then for each user, so for each person that wants access to the linkage enclave, we require a CV or biosketch for the investigator and any co-investigators. Everybody has to review and sign the DUA as an investigator, co-investigator, or research staff member. We require data protection plans for each person in each location where they will access the enclave. So for most people, this would be their office location in their home office if they work from home. We do not allow folks to access the enclave, say like at a Starbucks or at a hotel or whatever. You're only allowed to access the enclave from the locations that NHATS has approved. We also need the full legal name, business email address, and business telephone number. We collect this because this is what we use to add folks to the linkage enclave and go through the identity verification process, sorry. So once all of these materials have been submitted to NHATS, we've reviewed and eventually approved the materials. If there's any back and forth necessary, we will then provide the investigator with a fully executed data use agreement and an approval letter stating that NHATS has approved this user to apply for an NIA DUA to gain access to the NHATS CMS linked data. Okay, so we've listed here some common areas where we might have some back and forth or that folks need to be aware of. We do not accept what we call umbrella applications or sort of these more general applications for networks, research centers, or other coordinating efforts. We are looking for specific aims and a specific research topic that you will be undertaking. You'll note that on the list of data that I showed earlier, that we did not show NHATS geographic data. NHATS geographic data cannot be linked to the NHATS CMS files. We do offer restricted geographic data that is housed in a separate enclave, and the two data files cannot be used together. Two data types cannot be used together. We do have limited geographic information, public data that is available in the enclave, including a metro, non-metro indicator and census region. We offer two types of CMS files. There's the standard format, which omits geographic and provider information, and a provider ID format, which omits the geographic information but includes provider IDs. Any requests for these types of files need to be strongly justified. We also encourage everybody to review NHATS disclosure rules before applying. These are available on the NHATS website and discuss what kinds of analyses are allowed or not allowed, procedures for requesting data in or out of the enclaves. The other consideration that we run into a bit is that linkage uses id.me to verify your identity. We need your business email address listed on this list of users requesting linkage enclave access form, because this is what we input into to create accounts. And business emails are required when accessing the linkage enclave. Some folks may already have id.me accounts set up with a Gmail or personal email account. You just need to add your business email address to your account, and then the identity verification will proceed much more easily. Next slide, please. Okay, so I've mentioned a couple times our rules for disclosure or vetting. NHATS takes our participants' confidentiality and privacy very seriously, and we have taken steps to minimize the risk of identification or disclosure of our respondents in the areas in which they live. So we have limits on files that can be brought into or taken out of the enclave. All transfers are reviewed by the NHATS compliance officer as well as linkage staff. And these vetting rules are available on the NHATS website, so you can review them prior to even submitting an application, so that you'll know what kinds of things are allowed and if your research topic would even be allowed with NHATS. And these are included in the linkage enclave as well, so you have easy access to them. Okay, next slide, please. So that was a lot of information. I'm going to provide you some resources where you can find this information. So everything that Jen and I have gone over today is available on the NHATS website. We're going to highlight a few specific pieces of documentation that will be helpful for you if you're just getting started with NHATS. So we have user guides. We have several user guides that are available, including a quite large user guide now that describes the NHATS design, content documentation, and things you need to know about NHATS. We have a really handy FAQ document that describes how to use weights and sampling design variables in your NHATS or NSOC analyses. Technical papers on a variety of NHATS topics, including weighting, income imputation, and other special topics, including how NHATS created a dementia classification variable. Our survey instruments and crosswalks between the instrument and the data files are available online. And we've broken a lot of our resources and documentation into short getting started videos. It's basically the same information that is included in the online documentation, but presented in these more bite-sized videos. It's just another way to learn about the data and what resources are available. And we also have a self-paced online course that is available for free that you can register for, and it's through the Canvas website hosted at University of Michigan. Next slide, please. Okay, I won't go ahead and read through all of these. This is just sort of a taste of what kind of research areas you can use NHATS and NSOC data to study. There's a wide variety of research that you can conduct using NHATS and NSOC. Next slide, please. If you want to get a taste of what kind of information, what kind of studies have already been published, we post every publication that we become aware of on our website. It's tagged with years and up to 5 or 6 keywords. So you can search by year, by investigator or word, as well as these keywords if you're interested in a specific topic and you want to see what kinds of papers have already been published. And if you go to the next slide, you'll see that there's quite a few of those. these are the NHATS publications to date, and it just continues to grow. And we love seeing all the great work that comes out when folks are using NHATS and NSOC data. Next slide, please. And all of this information that we've gone over today can be found on our website, which is nhats.org. It's also where you go to register for the public use or sensitive data, where you go to download the data. And if you go to the next slide, please. We've listed 2 email addresses here. The first, nhatsdata@westat.com, is our more general help desk email. So if you have any questions about NHATS or NSOC, you can write to this email address. There's also a form online that you can fill out and submit to us. And then if you have specific questions about applying for or accessing the NHATS CMS data, the email address is listed below there. It's nhats-cms-data@jh.edu.